There are two common exercises that people do to help hip bursitis that may actually make the problem worse. Hi, I'm Dr. Dave Candy, and in this video, I'll explain what those exercises are and what to do instead to help your hip bursitis. Now, first of all, what exactly is hip bursitis? Your bursa are fluid-filled sacs on the outside of your hip, and there are actually two of them. One sits between the hip bone or greater trochanter and your gluteus medius tendon. The other one sits between the hip bone and the IT band. Now, if you're constantly overstretching those tendons over the outside of the hip bone from sitting with your legs crossed or standing with more weight on one leg than the other, or just having weakness in your leg when you're walking, that can rub the tendons over the hip and get the bursa inflamed or get the tendons inflamed. In fact, most cases of hip bursitis are actually tendinopathy or tendinitis. But regardless of whether you have hip bursitis, tendinitis, tendinopathy, the mechanism in which the structures get inflamed is the same, and the things you want to avoid are the same. Now, often when something hurts, our first instinct is to stretch it. And that's a reason why many people do this first stretch, which is a glute stretch, where they'll bring their leg across their body like this to try to stretch the muscles in their glutes or their buttock muscles. From the other side, kind of like this. And often that does give you kind of that hurts but feels good type of sensation. But the thing is that if being overstretched is the way that the structures got irritated in the first place, then stretching it more is only going to aggravate the problem, even if it feels good in the short term. So that's the first exercise to avoid, stretching your leg across your body. Now, the second exercise to avoid is somewhat similar, and that's doing an IT band stretch, where you cross one leg in front of the other and then push your hip out to the side. The intention of this is to stretch the IT band, but your IT band is actually a long sheet of fascia, basically a long tendon that connects the muscles in your hip down to the outside of the knee. You really can't stretch the IT band. It's an incredibly strong structure, and even if you could stretch it, you wouldn't want to, because the purpose is to take force from here and transfer it down to there. And if you stretch it, that force transfer breaks down. Additionally, when you stretch like this, it stretches the gluteal tendons and IT band over the outside of the hip, which only worsens the problem. So those are the two exercises to avoid if you have hip bursitis. Additionally, it's wise to use pain as your guide and avoid any other types of exercises that aggravate it, such as running, doing lunges, or walking long distances. Now, those aren't inherently bad exercises, but if they are causing you pain, you want to back off of them until you're able to do them without pain. So what should you do instead? Well, if the muscle being overstretched and causing irritation over the outside of the hip is the cause, you want to do the opposite. You actually want to shorten the muscle. And you do that by strengthening, getting the muscle to contract and shorten. One of the best ways to do that is practicing standing on one leg. So when you have weakness in your gluteal muscles, it causes your hip to drop down to the side like that, which stretches the tendons over the outside of the hip. And so you want to practice squeezing your gluteal muscles, contracting the muscles out here while keeping your pelvis level. Sometimes you may not be able to feel that drop intuitively, so it does help to do this facing a mirror where you can see if you're keeping everything level. Start on two legs, load your weight over to one side, squeeze your bottom muscles, and then try to lift your other foot off the floor without letting your pelvis drop. If you need to, you can hold on to something, either a counter or a table or a chair or a cane, to help keep your pelvis from dropping. And often it helps to hold on the opposite side. So if you're standing on this leg, use the opposite side while you're trying to balance. Now, once you're able to balance on one leg, you then have to progress that into other functional activities, such as walking. And often people who have hip bursitis have difficulty walking for long periods of time because their muscles tire out and then they start to rub the tendons and bursa over the outside of the hip. So if you're walking and you start getting hip pain, it's most likely because you're getting a slight pelvic drop causing those tendons to stretch over the outside of the hip. And so when you're walking, you actually want to think about squeezing your buttock muscles on the side that you're stepping on as you load weight over it so that you help keep your pelvis level, much like when you were doing the single leg stance. In fact, walking is really just a matter of standing on one leg and balancing momentarily, and then standing on the other leg and balancing momentarily over and over and over again. Now, if you can't do that for a long period of time, or you can't do it as long as you would like to, it can help to use a cane. Now, that's an unpopular recommendation because nobody likes using a cane. It makes people feel like they're old, and furthermore, people don't want to become dependent or reliant on it. But if your hip is hurting when walking, it makes sense to use a cane. There are a few reasons for that. Number one is if you're not strong enough to hold your pelvis level, and you do that step over step over step, over time, the problem is not going to get better, and it's most likely going to get worse. If you're only strong enough to, say, balance 80% of your weight with your hip muscles, then you need something to give you that extra 20% of effort until you get strong enough from doing single leg stance and other hip strengthening exercises to be able to walk without a cane. So you only want to use as much pressure on the cane as you have to in order to be able to keep your pelvis level and to be able to walk without pain. And then over time, you want to use the cane less and less and less until you don't need it anymore. So it's not something that you become reliant on. It's a tool you use to enable you to walk longer so that you do get stronger so that you can eventually get rid of it. Now, when you are walking with the cane, you want to move the cane at the same time as the sore leg, and that allows you to offload weight onto the cane. You can kind of lean off of it. It also prevents your pelvis from tipping down that way. It gives you a force going the opposite direction. So that's how to use a cane. Now, once you're able to walk without a cane, then you want to start doing more vigorous strengthening exercises. Doing single leg squats where you're balancing on one leg strengthens your gluteal muscles, or lunges where you're primarily using one leg to support your body weight and also keeping your knee midline, not letting it drift inwards. Those are all good strengthening exercises to do. Additionally, there are some other things that you should probably avoid if you do have hip bursitis. We mentioned that stretching with your leg across is not a good position, but you may be doing that at times when you don't even recognize it. For example, sitting with your legs crossed like that, sitting with your knees together, lying on your side with one leg draped over that way, or even standing primarily with your weight shifted over one leg. Those are all activities that cause hip adduction and stretch the muscles over the outside of the hip. Now, what do you do if the muscles feel tight? Sometimes it does feel really good to stretch across like that because the hip muscles may feel tight even though they're overstretched. And that's because your muscles, if you look at them on an MRI or a high-resolution ultrasound, they're not just one continuous band. They're actually a bunch of little muscle fibrils. And it's possible to have contractures or trigger points or knots in some of those individual fibrils while the muscle overall is overstretched. So how do you get those knots or trigger points to release when the muscle overall is overstretched and you don't want to stretch it further? Well, you can check out tips to release knots in the gluteal muscles in this video up here, or to learn how to sleep more comfortably on your side with hip bursitis, check out this video down here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos.